Welcome and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. Today we're going to be talking about something that I find relatively unique, at least according to what's out there for great information. We're going to be talking about something known as dental herbalism. We're being joined by two guests, Leslie Alexander, who's a practicing professional and herbalist, co-owner of Restoration Herbs in Franklin, Pennsylvania. She received her BSc in Environmental Sciences from Fairleigh Dickinson University in Teaneck, New Jersey, and her PhD in Biological Sciences from Heriot-Watt University in Edinburgh, Scotland. Our second guest, Linda Straub-Bruce. She has been practicing in oral hygiene since 1989, treating patients of all ages and levels of oral health. She is licensed in the administration of local anesthesia and is a licensed public health dental hygiene practitioner. I'd like to welcome to the Beyond 50 radio program both our guests, Leslie and Linda. How are you both doing today?
Great. Thanks for having us.
Yeah, thanks for having us, Daniel.
I know sometimes oral health can be a very tricky thing to talk about, but feel the freedom to just jump right on in when you have something to say.
Sounds good.
Thanks.
Now, tell us how this all started with dental herbalism. This isn't something you really hear commonly out there.
Well, no, it is a new topic, and Linda and I are very excited about our book, which is actually just coming out as we speak, Dental Herbalism, Natural Therapies for the Mouth. And it began really with the realization that most people are somewhat detached from the health of their mouth, and we wanted to create a resource for folks to bring home and make the care for the mouth easier, more understandable, more accessible, and, of course, using herbs. And founded on a really great understanding of the mouth, how it works, and conditions of the mouth.
You know, what I was really astounded by is we've talked about oral health on the program over the years and using the more natural approach to things. And it's really interesting how related, for instance, like plaque in the mouth has a relationship to plaque that builds within the heart arteries as well. And it was really interesting that as these people would piece these things together, how important having good oral health really is.
Yes, I agree. The science coming out on the systemic connection between oral health and the health of the body is coming out at a rapid-fire pace right now. Back in the 1800s, there was what was called the focal infection theory, and it was a good theory, but the science had not caught up to it yet. And what the theory was that your oral health has a direct effect on your overall health, and vice versa. So recently, these new links have been explored, and with the technology we have today and the science, they are coming out, it feels like almost weekly, with new information on how dental diseases affect other diseases in the body and how other chronic and inflammatory diseases in the body affect your oral health.
It's really interesting, Daniel, and most people who I work with as a herbalist find the idea really far-fetched. And yet, when we look at other parts of the body, say if we're out running and we take a fall and graze a leg, we're fast to clean that graze, not only to reduce the likelihood of a local infection, but also, for example, to reduce the possibility of that infection entering the blood and traveling through the body. So in that context, then, it's a little bit easier to think about what may happen if we have inflammation in the mouth and, say, when we brush or we floss or indeed even if we chew, there's bleeding. That same possibility exists for the organisms in the mouth, bacteria and fungi and viruses, to travel in through the blood and, as you said, locate themselves throughout the body.
Mm-hmm. Now, you talk about 47 common conditions, about that many, in the book that affect the mouth. Let's talk about some of the common ones that we tend to know about or that are usually expressed when you're seeing an ad for toothpaste, for instance.
Okay. How about periodontal disease? Linda, you want to kick that one off?
Sure. First of all, periodontal disease is not necessarily one particular condition. It's a series of different conditions that can affect the supporting structures of the teeth and the gums and the bone and the teeth themselves. But there are different levels and different extents of this disease. You have the healthy gum tissue, and then if you have an inflammation of the gum tissue or an irritation of the gum tissue, we call that gingivitis. The best analogy I have for gingivitis is if you get a sliver in your hand and your skin swells up in response to that irritation, or if there's infection there, that would be the comparable level for gingivitis. It is an inflammation of the gum, but it has not spread down to the bone. When gingivitis persists and continues on to the next level, that's where we call periodontitis. And there's various types of periodontitis, but the most common is called chronic periodontitis. It is a low-grade chronic inflammation and infection of the inner lining of the gums that spreads down to the bone. It's asymptomatic. There's not symptoms of it typically, and the symptoms that do manifest are easily dismissed. It's a painless process, and it is very common as far as in the United States. It's estimated by the American Academy of Periodontology that almost 50% of Americans over 30 years old have some type of periodontal disease in at least one area of their mouth.
Mm-hmm. Now, I wonder if it's true that when a person gets cancer of the mouth, if that's one of the hardest things to detect because of the lack of pain. Is that true?
Exactly. Oral cancer is really something that we struggle with here, especially in private practice. It can be very difficult to detect. It can be very subtle. There can be small changes. Sometimes, typically, if you see it at the base of the tongue or in the back of a tonsil in the throat region, it can be difficult to see. The changes are subtle, but the problem we get into with oral cancer is that it is very rapid when it spreads. It can be lurking under the surface with very small manifestation on the surface, and it could be quite painless. A lot of times, if you have a problem on your skin on the back of your hand, you can easily see it, but normally at home, we cannot see what's on the roof of our mouth. So we're relying on medical, dental, holistic practitioners to help kind of take a look and look for those subtle changes. It can be very difficult to detect, and what we're seeing more and more is less oral cancer related to tobacco use and more oral cancer related to HPV, the human papillomavirus. Now, a person with a healthy immune system could be exposed to one of the over 200 strains of the human papillomavirus, and their body can clear that virus from their system. Now, there's over 200 strains identified. There's more strains that they're identifying all the time. Of those 200 strains, about 9 or 10 are known to cause cancer. The one implicated most commonly is called HPV-16 in oral cancer. So if you have a healthy immune system, you are more able to clear that virus from your body. If your immune system is suppressed or depressed or exhibiting the side effects of chronic inflammation, you are not able to fight that virus as well. And the example I give to you with that relates to periodontal disease. If you have chronic periodontal disease going on in your mouth with bacteria circulating through the bloodstream and inflammatory mediators circulating through the bloodstream, you're burdening your immune system, and you don't even know it. So you have less of a capability. So we're finding that people that have periodontal disease are more susceptible to that HPV virus grabbing hold in the mucous membranes and causing those oral cancers.
And that's one of the great things about using herbs in the mouth is not only can we intercede with both acute and chronic conditions, but also we can strive to maintain the mouth using herbal products to brush the teeth, to rinse the mouth, and to address these concerns as and when they arise.
I wonder, what are your thoughts, either of you, or perhaps both of you, when it comes to people buying toothpaste and mouthwash in the common market? The quality of these products that are out there on the shelf.
Well, I'll say, do you want to go ahead, Leslie?
No, go ahead.
I would say, it depends on the product. My issue with a lot of the commercial products is the chemistry there. Most of the toothpastes have an ingredient called sodium lauryl sulfate. We call it SLS for short. It is a detergent agent. It doesn't really provide you a lot of benefit to your toothpaste besides giving you that foaming action, which is to give you a perception of clean. Toothpaste with or without SLS in it clean just as effectively as another, but it gives you that sense of foam. A lot of them don't really have astringent, antimicrobial action. Some of them have antimicrobial action, but it tends to be more chemically based. And personally, and for me, and I think that the trend in our country is to lower the chemical impact on our bodies and ourselves and kind of turn more back to natural products.
And I think what the advantage that herbs bring to this topic is that they are all natural, that many of the herbs that we work with in our book, Dental Herbalism, can be grown locally and are easy to grow and easy to prepare. So in the case of mouth rinses, for example, we can work with mouth rinses that are alcohol-free, thereby avoiding drying the gums. We can change flavors to accommodate individual preferences by formulating small or larger batches. And of course, in our book, we're giving instructions on how to do just that. And we can accommodate changes in the mouth because the health of the mouth is not static. So it's changing not only from tooth to tooth, but from family member to family member. So it enables us to customize oral care products and I think this is an important point about commercial products, a far less expense. I mean, mouthwashes, rinses, toothpastes, even toothbrushes amount to several dollars each month or every quarter when we look at all family members.
Now, it's fascinating because we had a guest on the program some time back where we talked about daily rinsing of the mouth with use of coconut oil, but he also suggested, it could be pretty much any food-grade oil, but if you can get a hold of coconut oil, that would be the best for removing a lot of things in your mouth that generally brushing your teeth may not be able to do. What are your thoughts on something like that?
Well, we actually call that oil pulling, and we do talk about that in the book. It comes from an Indian or Ayurvedic approach to health care. And in India, the primary oil is indeed sesame oil, although as this approach to cleaning the mouth comes to America, we've broadened it to the use of a number of oils. Sesame oil, of course, also coconut oil, as you mentioned, Daniel. We also can use olive oil or hemp seed oil. And when we pull oil, the biggest difference between brushing and pulling oil is that we are really working through the mouth in its entirety. And with the mind, we focus on bringing that oil back and forth between all of the little crevices between our teeth and our gums, and thereby removing these smaller particles that might be overlooked because we're using an incorrectly sized brush or not reaching the back of the mouth, or perhaps we're a teeny bit sloppy, always missing a particular part of the mouth, which is why it's always a great reason to work with a dental professional so that they can help guide and shape care of the mouth. But oil pulling is fantastic, and people report marvelous results pulling from anywhere between 2 minutes to 20 minutes.
Mm-hmm.
In addition to that, Daniel, that practice is an old practice, and it is gaining mainstream attention. There are studies and data coming out on its effectiveness and the benefits of oil pulling and the various oils on the tissues in the mouth. That is something I think that we're on the cusp of, that you're going to see more and more. And even the national commercial product companies are giving a little more attention to these ingredients. So this is something old, something tried and true, that's going to be coming into fashion. You're going to see that a lot.
Isn't it fascinating how great-great-great-grandma's remedies were fantastic and now they're mainstream and people are scratching their heads like, why did we ever put this on the back shelf in the first place?
Yep, and I think that's kind of where it's going. We got away from natural products. We became a little more of an instant gratification pill-popping society, a little more pharmaceutical, but I think you're kind of seeing people return to the basics, the safety, the effectiveness, the tried and true.
You know, speaking of that, it's when you said pill-popping, it reminded me of a friend of mine who apparently, as he was growing up, would take aspirin, but he would chew the aspirin, and apparently that's not a good thing to do because it literally destroyed the back of his back teeth. And I'm thinking, why would you chew aspirin in the first place, you dummy? But what is it about aspirin that causes, the disintegration of teeth?
Well, aspirin, and I actually, in addition to that, I have seen several people that would put aspirin kind of between their gums and their cheek, and it can cause a wicked ulcer. Aspirin can lend to a acidic pH. It's very beneficial for a lot of reasons, but it wasn't meant to sit on the mucous membranes of the mouth or on the teeth. So when we think about the teeth, they're made of minerals, strong minerals. The kryptonite for teeth is acid. Enamel is very strong. Here in dentistry, we use two products to cut enamel. We use carbide and diamond. Those are the only two things that are able to drill through enamel. But enamel is very susceptible to acid. And if we think back to our science classes that we all had, we know that a neutral pH is 7. 7's middle of the road. It's not acidic or low pH. It's not alkaline or high pH. There's something called the critical pH. That is the pH where enamel begins to demineralize or weaken and become susceptible to bacteria, acid, and different byproducts in the bacterial byproducts that can affect the enamel. So it makes us susceptible to decay. That critical pH is 5.5. So when your friend was exposing the teeth to that repeated acid exposure, he was taking the pH down, he was exposing that area of enamel to an acidic environment. Now, it's not necessarily the quantity of acid that the teeth are exposed, it's the frequency. So if you think about it, if your saliva takes 30 minutes to buffer or neutralize in an acid environment, if you have one piece of sugar or one sip of an acidic drink every 30 minutes, you're providing a constant acid exposure to those teeth. So what you would be better off doing is doing it all at once and having it over. There's enzyme in your saliva that will help re-strengthen, remineralize, and rebalance that acidic environment to the teeth.
And your friend, who was probably keeping an aspirin in his mouth because of pain or discomfort, would have been better advised to avoid those acid conditions and to have worked, for example, with herbs that we talk about in our book that help overcome pain and discomfort and reduce inflammation.
And
now,
in addition, in the book, she, to follow up on Leslie's point, we have some great mouth rinses that if you do have an acid exposure, or if he was just really firm on chewing those aspirins, he could follow that up with a square mouth rinse that has baking soda in it to neutralize that acidic environment, instead of just waiting for time for the saliva to rebuffer and neutralize that environment. You could pick a recipe out of the book and help that along by neutralizing that acidic environment.
Speaking of baking soda, my own mother, as I was growing up, felt that it was a good idea to brush with baking soda. What is your thoughts on that?
I love baking soda. It is one of, I really do.
It is such a treat.
I know. It is one of my favorite products, and you don't necessarily have to just brush with it. But I will tell you, it's an acquired taste. I don't mind it. I do enjoy it. Mm-hmm. In the book, we have some information about various essential oils that you can add to homemade paste to kind of temper the
herbs.
taste. Yep, yeah. Right, powdered herbs. And you can experiment with it and have fun with it. Try the different recipes out and see what works for you. But baking soda is a natural agent to neutralize acid. It has baking soda and salt are two of my favorite things for antiseptic, anti-inflammatory, and to neutralize acid. But sometimes it can be a little more palatable in a rinse. And Leslie can probably tell you about the square rinses in the book that are really great with baking soda.
One of the things when we mix an herb or baking soda or any other ingredient that we're using in the mouth, when we mix with water, we're not really taking advantage of the space, if you like, Daniel, that's available, that water provides. So we can use herbal rinses and mix those with baking soda. So we can make a tea, which is, for example, rich in vitamin C and will help the mouth in building collagen and strengthen the teeth and the gums, and mix that with baking soda. Or, as I interjected just a few seconds ago, we can use a variety of powdered herbs, cinnamon being a great example, mixing it with baking soda. And then we have what's called a tooth powder. And one way to use a tooth powder is to dampen a toothbrush or indeed a chew stick, and you can read about those in our book too. Dip it in the powder and then brush the teeth in a normal way, rinse in the normal way, and there you go.
I'd like to quote from your book, because this ought to give our audience, our listeners out there, reason to be picking this up. That certainly encourages me as I read it. And that is, it says, mouthwashes can be a pleasure to formulate. They are also medicines and are formulated to meet the current needs of each person. Formulating in batches that support use for a week or two is likely to provide more opportunity for experimentation. See, folks, we can actually not only make our own mouthwashes by using this book, but you can also experiment on what is useful for you. Tell us about some of these mouthwashes and what they actually do in line of prevention, for instance.
Well, I think rinses are important. And before we even get to using rinses, I'd just like to say that young people learn their oral health hygiene techniques from not only visiting hygienists like Linda or dentists like Bill, but from watching siblings and parents. So anything flavorful that would encourage practice and the sustenance of oral care is really important. So we can use rinses made from straightforward mints, which are pleasurable, although children don't really move towards minty flavors as quickly as adults. Sometimes mint flavors are a bit too big for children. So we can use, for example, stevia to sweeten any rinse, or raspberry leaves, or thyme. Many people are familiar with the taste of thyme because it is continuous. It we continue to use it in commercial oral care products. So we can formulate a rinse by adding a herb to boiled water and letting it steep. We can add one herb or multiple herbs, letting it steep for about 10 minutes, 15 minutes, draining the herb off, letting the resulting liquid cool, what we normally call a tea, and using that as a rinse.
And in addition to that, yeah,
Go
Daniel, just to interject, Leslie, you're going to see more research and proof that these teas not only are pleasant, but you have an antimicrobial effect. It is being proven in large research studies that these green teas and various teas can reduce the inflammation that comes with periodontal disease.
And not only inflammation, but the accumulation of plaque, and they help us sustain a daily habit. And as I mentioned earlier, we can change the rinses depending upon what's going on in the mouth. So an adult or a child, for example, who's been recently fitted with braces would be using a different rinse than a person who has no irritation or inflammation going on, even of an acute nature. A person who is recently had a tooth pulled might use a different rinse than the person who has had no extractions within the last 24 or 48 hours. So we provide these alternatives in dental herbalism, natural therapies for the mouth.
Now, you outline 41 herbs, as I understand it, in your book. What would you say would be the granddaddy of the herbs that you talk about?
Oh, well, that's a hard question. Everyone says, so what's your most favorite herb? And it really, without trying to avoid your question, it depends on the person. Mm-hmm. I think that turmeric and yarrow and myrrh and sage and thyme, those are the granddaddies we present. We spent a lot of time, Daniel, in narrowing down these herbs because actually there are hundreds and hundreds of herbs that have been used over thousands of years to care for the mouth. And we chose to focus on those that people are most familiar with, those that are most safe, and those that are most effective. So safety, efficacy, and familiarity in that order played a great deal into our final choice of these herbs.
So it sounds like Simon and Garfunkel were right then.
Parsley, sage, rosemary, and thyme.
Right. There you go.
That's a good place to start. It's a very good place to start.
How about tooth pain? You know, you go on the Internet when you get a toothache, and boy, I'll tell you, pain in the mouth is not something I don't think anybody enjoys. But what is something that you recommend out of your book for tooth pain that can actually help alleviate it, at least until you get to the dentist?
Well, exactly. So we have a variety of solutions to deal with pain. Let's start with the kitchen cabinet. One could be a clove, just an ordinary clove that you might use when you're mulling wine, for example. And placing a clove at the point of pain or discomfort is certainly one solution. Another is we work with essential oils, some of which we add to powdered herbs. So peppermint and turmeric, for example, peppermint essential oil combined with a turmeric powder would be an excellent intervention, or either can be used independently. We can also use herbs such as willow bark, again in its powdered form, to make a wee paste or a poultice for a particular area of inflammation. Maybe we might moisten that willow bark with anti-inflammatory herbs or herbs that improve blood flow, because what we want to do is to stimulate flow to an area where there is pain or discomfort. So I don't know how many interventions for pain or discomfort we present in our book, but many, many indeed.
Mm-hmm. Pain is typically, dental pain is due to inflammation. Now, you may be at home and not have dental expertise or your current x-ray of your tooth available, so you're not sure if it's coming from the gum tissue or is it coming from within the tooth itself, such as an abscess. So what the beauty of this is that the way that we've outlined the herbs, you can see which herbs are analgesic, which ones, in other words, will help reduce pain, and which ones are anti-inflammatories. So that's where, if you're having pain, you need analgesia to relieve the pain and break that pain cycle on a biochemical level. And you also need to reduce the inflammation to get some relief from the source until you can find out what specifically is going on and get it taken care of. So what you're able to do is follow along in the chart in the book to look for herbs that can be used for those purposes. So say you try one combination and you get a little relief, you could safely the next time create a new combination to see what works for you with what particular problem you have going on. But the beauty of the herbs that were selected for the book is that they're safe. They are safe, they're easy, and they're readily available to anyone.
Here's one question for you. I came across in a conversation. We were sitting in a group and got into talking about teeth of all things, but one of the women that was in the group was talking about how eventually she felt she was going to lose all of her teeth due to the fact that she just has what are, I guess, called soft teeth. And, you know, I was just kind of wondering, is it possible, let's say a person does have soft teeth, they kind of crumble or whatever it may be that they have to deal with, to build or, you know, sort of make them stronger?
Well, I will tell you it's kind of a misconception, and there's two things going on right there. I will tell you 25 years in dentistry, most teeth that are lost are typically lost due to chronic periodontal disease. There are 101 things we can do to fix a damaged tooth or a tooth that has decay. But I'll tell you right now, with our technology, when you have the bone loss that comes with chronic periodontal disease, it's for good. It's forever. When you lose that bone, it will not grow back. So typically, if someone really is motivated to save their teeth and they have good bone, they're more than likely able to save their teeth. If the gum disease has taken hold, has advanced, and they lose the support, imagine building a house on a very poor or foundation built of sand. Your house is not going to stand on a foundation built of sand. So typically that's where tooth loss happens. But the second issue...
I'm sorry.
Sure. Go ahead, Leslie.
No. I was just going to say one of the things that's really important to sustaining and maintaining the health of our teeth is what we eat. And so diet affects the strength of our gums and our immune system, which Linda was talking about earlier. And this, too, plays into what people call keeping our teeth. You know, Weston Price years ago published some work, and we are amazed that, many people are amazed to think people that our teeth don't naturally fall out. Many people can live to a ripe old age with all their teeth. That was all I wanted to interject.
Sure. And in addition to with your friend, the thing to kind of give a little spin on what Leslie said as far as nutrition goes, bone in the jaw that supports the teeth, the ligament that holds the tooth to the bone, and the tissues around the teeth are constantly regenerating and growing. So if you have good nutrition and you're healthy, you are more apt to have healthy supporting structures for those teeth. Now, conversely, when the teeth are formed, they're formed. Enamel does not regrow. So the key is, number one, the ideal is you prevent acid or exposure, demineralization to the enamel and the teeth. But if your friend, there's not really something called soft enamel. You could have enamel that's highly susceptible to acid.
Mm-hmm.
That's probably where she is. She easily gets decay. She may have acid reflux, which makes her whole digestive system, and that includes the saliva in the mouth, more acidic. She may have a highly acidic diet. She just may be a little bit more on that acidic pH, so she's constantly getting acid damage to the enamel.
And Linda, is it possible that perhaps also the mouth is dry due to pharmaceuticals and therefore saliva production would be suppressed?
Exactly. If you look, we have a chart in our office, and it never ceases to amaze me to look at this chart. We have a list of medications, prescription and over-the-counter, that cause dry mouth. There are hundreds and hundreds of medications on this list. When the mouth is dry, you lose the benefit of that magic elixir that is saliva. It has enzymes that will help re-strengthen, remineralize, rebuild your enamel. If your saliva is suppressed, first of all, you don't get that benefit. You don't get the buffering agents that bring you back to a neutral pH of 7. But also, in addition to that, saliva has the extra benefit of helping to naturally cleanse and wash the bacteria out of the oral cavity and down to the esophagus and the stomach where it can't survive the stomach acid. But if you have a dry mouth, especially due to all these pharmaceuticals, it can help that bacteria overgrow. So what happens is the simple formula for acid is bacteria in your mouth, which we always need for normal good flora. You don't want to have a sterile mouth. You need good bacteria. But even the good bacteria in your mouth takes any kind of carbohydrate or sugar. It consumes it and produces a byproduct of acid. So if your mouth is dry, we call that xerostomia. If your mouth is dry, that bacteria will overgrow and you will have a surplus of acid sitting on the teeth constantly, causing that enamel erosion. Your enamel won't grow back, so once it's dissolved, that's gone for good. You have a finite amount of enamel. When the enamel has worn through to the next tooth structure called dentin, or if decay has reached dentin, that's when we have to do fillings and do work. If you have weak enamel, you can re-strengthen that enamel.
Well, that's very encouraging.
Sure, yeah.
I think it points to encouraging people like ourselves and others out there to really stop and think, well, what do I know about my mouth? How many teeth do I have? Which ones are filled? How can I best care for my mouth? And how can I continue to be involved in the care of my mouth?
Mm-hmm.
And many people avoid professionals like Linda and other dental professionals because of a fear of pain. And, you know, technique and technology has advanced so much over the last few years alone that many of those fears are unfounded. And we encourage people to take hold of caring for their mouth and the structures in their mouth and to work with professionals, both dental professionals and herbalists, to sustain not only their oral health, but, as we were talking earlier, the entire health of the body.
Now, tell us the website our listeners can go to where they might be able to get the book and more information about how to do what we're talking about here today.
Absolutely. They can like us on Facebook. They can like Dental Herbalism. Your listeners, Daniel, can also go to www.dentalherbalism.com, and they can order the book there either from our publishers directly, that's Inner Traditions Bear & Company, or we offer other possibilities, including Amazon, Barnes & Noble, and Simon & Schuster.
Very good. Linda, Leslie, I want to thank both of you so much for taking the time to make a conversation about teeth really a very delightful and educational one for our listeners out there.
Thanks for having us, Daniel.
You bet. Go ahead and give out that website one more time.
It's www.dentalherbalism.com.
Very good. Thank you both so much for joining us here on the program today. It's been a pleasure.
Thank you.
Thank you.
I want to thank you, the listeners out there, for tuning in. Dental Herbalism. Let's take care of it and take care of our mouths. That way we can smile broadly knowing that we feel better about what we've done for ourselves. You can also visit us at beyond50radio.com. That is the number 50. We'll have a link there for you to find out more about how to practice good oral hygiene. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program. And remember, live your day past halfway.